Over the next year, more than a third of nurse educators are planning to retire or to leave academia. We know in nursing that there tends to be ups and downs as it relates to the nursing shortage. So here's the question. How are you preparing yourself today as a nurse educator to stay in the classroom, the clinical or sim setting for the next year, the next 5 years, or maybe you have 10 more years until you retire? Well, first, we want to celebrate those nurse educator colleagues that are planning to retire. That is an amazing accomplishment. It's not one that's in my vision within the next several years. But for those of you that are planning to retire, congratulations. We're always excited to meet colleagues when we go to conferences who are planning to retire in the next year. And this is our message to you all. We want you to stay in the workforce. Now, I know you've probably been working a long time to get to the point of retirement, but you're leaving with so much expertise and so much credibility as it relates to nursing education. So that's our recommendation. Consider, yes, mentoring the next person that's going to step into your shoes, but also consider staying on as adjunct. Or seeing how you can be a consultant with your current university or college. All right, so that's our message is congratulations, but also we would love to keep you in the profession for just a little longer, even if it's mentoring or in a part-time position. In this snapshot, we are going to continue to explore how do we use valid and reliable tools and assessments to ensure that learning is actually happening. We're mapping these different evaluation strategies that are described in Chapter 16 in Billings and Halstead to actual learning theorists. If you haven't already, go ahead and print out the study worksheet that's listed right here in the description, as well as pull out Billings and Halstead. There are two sections we want you to look at for this snapshot. So first is going to be Chapter 16. And the second resource we want you to take a look at in Billings and Halstead is Table 14.1. You probably guessed it. That is one of our favorite parts of the sixth edition. And Billings and Halstead really is what we consider to be our Bible in nursing education because it's rich with so much content to help us take a deeper dive in aligning our teaching strategies and evaluation strategies with the actual evidence. Now, there's a far more content in the textbook than what we mentioned, but for most of you that are on the journey to C&E, we want you to stay laser focused and be able to move forward on your C&E journey with ease. Not that it's going to be easy. And what we're doing is we're compressing time for you by giving you a 7-week study plan with specific page numbers in Billings and Halstead textbook and Dr. Caputi resources in our actual masterclass and in our self-paced course. So what you're finding here on our YouTube channel is an introduction and you want to go deeper or you know you need to go deeper, which most colleagues do, then head to our website, drsellerseducate.com, and that's where you're going to find a masterclass that's available as well as our self-paced course. And here's the good news. Once you register for any of our programs, they never expire. Okay, so we believe in supporting you on your journey until you are successful, no matter how long that takes. All right, so you printed out your study worksheet. You have Billings and Halstead in front of you. Excellent. So that means you're ready. Now, what I want you to do is take some time to reflect. Reflect on exactly why you're here, right? And what evidence-based strategies you're already using that align with what we're going to discuss today. Okay, so write down your objective, write down today's date on your study worksheet, and then reflect on what you're already doing a really good job at and maybe what you want to work on or strengthen in the future. James Clear talks about in his book Atomic Habits getting 1% better every day. In this snapshot, that's what we're focusing on. How do we compound and grow into that 1%, 2%, 10% every single day to ensure that we are not only helping ourselves get better, but also ultimately creating a better learning experience for our students? That's what this series is all about. That's what our mission is all about here at Dr. Sellers Educate, is to taking you on this journey to learning not only about how to achieve success on the CNE exam. Now, that is a goal that we have for you, but also how do you become a better nurse educator? We know that when we're a better nurse educator, we create better learning experiences for our students, and ultimately it leads to better student success and the better delivery of nursing care. That's our ultimate goal, is that we're able to develop our nursing students into safe practicing clinicians. All right, so this is what we're continuing to explore. You have your worksheet, you have Billings and Halstead in front of you, and now we're going to talk a little bit about content that is aligned with the work that James Clear has already described in his book, and that is centered around the power of small gains. When we're able to make this 1% incremental change and difference of improvement every day, we're able to leverage our prior knowledge to build on that. We in nursing education and in education in general, we call that scaffolding, where we're able to start with that foundational level, going back to cognitive learning domain. If you take a look on page 188 in Billings and Halstead, we start at that lowest level, which is remembering, but we don't stay there with our students, right? We have to scaffold their learning till they get to application and ultimately analysis. And that final highest level of learning for cognitive learning domain is creating. And this is what we want you to do right now on your study worksheet. We want you to write down, what are the other two learning domains? So we talk a lot about cognitive. That's what we're continuing to explore in this snapshot. But what are those other two learning domains? And what are the verbs associated not only with cognitive taxonomy, the Bloom's taxonomy for cognitive learning, but also for the other two learning domains? I almost gave it away. All right, so I want you to take some time to look at page 188 through 190 and go deeper into understanding all three of the learning domains. As educators, we want to foster this mindset of improvement, right? Incremental improvement to engage in this transformational processes. Now, we know in nursing education, there are transactions that happen, right? So there's an exchange of ideas. We develop excellent content for our students to learn about from a didactic setting. We give students a chance to practice those skills in the skills lab setting, in the simulation setting, where there's no risk of harm, right? We give that formative feedback continuously. And then ultimately, we want students to make those safe patient care decisions in the clinical setting. Well, when we develop that foundation, that's in that didactic setting, right? We're able to introduce the theoretical concepts. Well, we can't stay there. We want to reinforce, we want to clarify any muddy points that students have on their journey to learning. Well, we take that same approach at Dr. Sellers Educate. We introduce concepts here through our snapshots. We build on those experiences that you all are having in the educational setting by establishing a community. That's through our boot camp, our monthly boot camp. And then we empower you all by equipping you with the final support that you need through a master class so that you can achieve not only excellence in the classroom, but also achieve that passing score on the C&E exam. So in so many ways, yes, we're talking about your journey towards C&E, but we're also talking about how can we leverage and really engage in these small gains with our students in the classroom, so ultimately we're able to easily validate learning and also align with evidence-based practices. The content that we're talking about in this snapshot is aligned mostly with Competency I for C&E, which is related to facilitation of learning. But how many of us know that in order to be a really good teacher, we have to ensure that learning has actually happened? So what does that mean? When we look at these sub-competency statements, these behaviors under facilitative learning, and if you're on the journey for C&E novice or C&E clinical, you can take a look at your blueprint as well, and you can map some of these key concepts we're discussing to the actual competency for yourself as well. When we think about the ability to engage our learners in the actual learning process, it crosses 50% of most of those sub-competency statements. So in order for learning to happen, we have to be an effective facilitator of that learning process, right? To be able to keep students engaged, just like we try to do here during our snapshots, so that they will be able to close the loop and to comprehend the concepts that we are discussing. Okay, that's our goal with our students. Let's take a look at our thought-provoking question and see what you all think about this one. So in the context of fostering a culture of continuous improvement among nursing students, which of the following strategies best supports the long-term retention and application of clinical skills while also aligning with the principles of incremental improvement and competency I, facilitate learning. All right, so we have three choices. The first one is A, focusing exclusively on comprehensive assessments at the end of each term to gauge knowledge retention. B, incorporating spontaneous, unannounced practical exams to stimulate high-stakes environment. Or C, encouraging students to practice one specific clinical skill daily, building upon each skill progressively over the course of the term. I'll give you a few seconds to take a look, and I want you to remember our two-step process. First step is, what is this question really asking me? The second step, what is it that I know for sure about content related to this question? All right, so if this is a muddy point for you, this is what I want you to do. I want you to write down what is unclear about this question, or what are the options that you are kind of weighing. So maybe you've gotten it down to one or maybe two options. Maybe you've eliminated one choice. And then I want you to think about what makes the option true, right? So the two options that you have left, what about those two options that make you think that it could be true? This is going to help you really break apart these incorrect options that we're going to talk about at the end of our snapshot, okay? And that's what we want you to start thinking about. Remember, these are thought-provoking questions. Here's the good news. They're not going to show up on the C&E exam. We don't write questions for NLN exams. That would be a conflict of interest. And so we want you to start thinking about what can you draw from each of these thought-provoking questions, okay? And we're going to talk about the rationale, which is a really good point to bring up. When it comes to your ability to feel more confident in answering practice questions or thought-provoking questions, it does take practice, but here's the caveat. We don't want you wasting time on practice questions, okay? We want you to stay focused in comprehending the concepts that are being asked about in those questions. The thought-provoking questions here, the NLN self-assessment exam, and Dr. Caputi's review book has the practice questions at the end of every chapter. Those are the only practice questions that we recommend, and here's why. When you go out and you purchase other resources, that information may or may not be aligned with the NLN recommended content and competencies. So then what happens? You get confused, you get frustrated. So we don't want you wasting time. We want you to stay focused using either the NLN self-assessment exam for practice questions, or our thought-provoking questions, or Dr. Caputi's practice questions at the end of those chapters. This is going to help make sure you stay aligned with the recommendations from NLN. Okay, so now I'll get off my soapbox, but that's my recommendation. We want you to stay focused on your journey, and that's one strategy you can use to make sure that that happens, not using all those other resources, okay? Let's talk a little bit about the psychomotor learning domain. All right, so I'm going to turn in Billings and Halstead with you all. You're going to turn to page 189, okay? So 189 is where you're going to find this actual taxonomy, okay? So it is page 188. It's figure 10.2. We get questions about this learning domain from time to time. All right, so what do you see happening? You see scaffolding in figure 10.2, page 188 for the psychomotor domain, just like all the other taxonomies. And you see that lowest level is imitation. And then you see manipulation, precision, articulation, and that highest form is naturalization. Now, I want you to write down, before we continue, what do you think is the definition of naturalization? All right, so just write it down for yourself. What do you think the difference is between that lowest level and that highest level when we look at psychomotor? We talked about cognitive learning domain, that lowest level being remembering, the highest level being creating. But why do you think when we look at figure 10.2, imitation, what is that definition? And what is the difference in behavior you're going to see at that lowest level versus the highest level? All right, so I'll give you all a chance to write that down. And we'll keep going and we'll come back to the differences between the two and see how it kind of compares with what you wrote down. All right, so let's keep going and talk about the learning theory. I know that's maybe what some of you are waiting to hear about. What is the learning theory that we're going to focus on in the snapshot? Well, it is Jerome Bruner. Okay, his work is aligned most closely with cognitivism, taking a look on page 249, table 14.1 in the 6th edition. If you have the 7th edition, remember that the crosswalk is right here in the description between the 6th edition and the 7th edition. Okay, that was developed by Elsevier. So if you have the 7th edition, we still want you to use that one. Okay, you don't need to go out and buy the 6th edition. Just know that the 7th edition does not have that wonderful learning theory crosswalk that we like to see, right? That learning theory crosswalk on page 14.1 gives us the descriptions, the tenets, some examples of actual evidence-based practices that are aligned with the theories, but the information is still in the 7th edition. It's just within a different chapter that you can learn more about in the crosswalk. All right, so we like the diagram or the table of 14.1, but if you don't have it, that's fine too. What does his work talk about? Really that learning is shaped by others. That key word is shaped. Not that we draw all of our learning and our knowledge from others, but it does shape how we learn and actually what we learn. So I'll give you an example. When we're lecturing, that can be seen as a pedagogical practice, right? Because we're the expert, we're the content expert, much like what we're doing right now. However, I am asking you all to reflect and to engage in your own learning experiences that you've had and be able to grow from those and really assimilate those into the conversation that we're having in this snapshot by participating either tactile, from a tactile standpoint, kinesthetic, where you're writing it down, or maybe you're going to participate in the chat. Okay, if you're watching this live, and even if you're not, go ahead and put it in the chat. We always like responding to your comments. All right, so with cognitivism, what you want to know about learning theory as it relates to the C&E exam is going to be the verbs, specific teaching strategies, where that specific teaching strategy and evaluation strategy shows up on Bloom's taxonomy, the different levels. And then you want to know what learning objectives you are going to write as it relates to the different levels for the learning domain. Okay, remember we talked about 3 learning domains earlier: cognitive, psychomotor, and hopefully you wrote down the third one of affective. Okay, pages 188 through 190 give you great examples and some details as well about each of the learning domains. All right, so let's keep going and looking at cognitivism. What else do we know about it? Well, that cognitive development, it involves remembering, problem solving, and decision making. And look at the last part, from childhood to adulthood. Now we know that maturity and our ability to make decisions isn't always related chronologically. Yes, we should make better decisions and be able to solve more difficult problems as we get older. However, we know that sometimes our students can get stuck. When we look at Kolb's experiential learning theory, we want to be able to help students move through the learning process, right? There are 4 phases of learning associated with Kolb's work, and you want to help students move through those phases. How do we do that? By being very specific and integrating those teaching strategies that are going to move students through those 4 phases. If this is a muddy point for you, this is what we want you to do. Write it down when it comes to Kolb experiential learning and those specific teaching strategies to help move students through all 4 phases. It's the same when you look at Tanner's clinical judgment model. We want students to be able to move through the development of clinical judgment skills. How do we do that? By integrating evidence-based teaching strategies that are going to help students get unstuck, help students think differently about how do I make my patient care decisions? How do I even know what my next step should be when I have a systolic blood pressure that is 70? Or when the patient tells me that they can't breathe well, or I notice a pulse is no longer there. Before it was 3 to 4. This is on a post-op patient. Or now it may be that the skin is cold and clammy. What am I going to do when that pulse changes from a 3 to a 4 and the strength to maybe a 1, or maybe I can't feel it at all? It's thinking about, what am I going to do next? What does the evidence say? How am I going to keep this patient safe? Our ability to engage in the learning process with our students really depends on us having a clear understanding of how my intentional teaching strategies are going to help my students get 1% better every day and make those safe patient care decisions. All right, I know that was a lot. So if Tanner's clinical judgment model is a muddy point for you, write that down. And if Cobes is a money point for you, I want you to write that down too. There's content that is in Billings and Halstead that we can help you with. And we also have content embedded in our masterclass and our self-paced course to help you as well. All right, remember, we're here to help you until you are successful, no matter how long that takes. We don't want you to get discouraged. We want you to stay focused and thinking about, how am I in my classroom effectively helping my students learn? That's what this series is all about. All right, so let's take a look at some examples. That's what we want you to write down next. You can use chapter 16 in Billings and Halstead to kind of guide you. There's also some examples on table 14.1. All right, so before we go forward, let's go back and talk about psychomotor learning domain as you all are thinking about some teaching strategies that are aligned with cognitivism and Bruner's work. So hopefully you've written down now the difference between imitation, that lowest level, in figure 10.2, psychomotor learning domain, and naturalization. Let's take a look at what some of the verbs are that are associated with these two different levels. So naturalization is all about creating, revising, vary, alter. Those are some verbs associated with it. And then imitation, repeat, imitate, follow, show. All right, so that makes sense, right? When we talk about that lowest level, students are truly imitating either what they've seen or what they've read about related to the steps that they should follow when it comes to sterile technique. Let's talk about Foley insertion. You all know that's one of my favorites to talk about as an example, just because it's so relevant. So when we tell students what the steps are to follow sterile technique, we know that, first of all, we have to introduce it from a didactic standpoint, right? We have to ground our patient care practices in the evidence with our students, because that's what we want them to do once they graduate. And the second step is we want students to be able to imitate that or complete a return demonstration. So we engage them in the skills lab to be able to do that. And then what happens? More repetitions, right? Students keep coming back. And then what happens? They start to get really good at it, right? Then they start becoming more confident in their ability to insert an IV, insert a Foley. And we want to empower our students once they are able to hone in on those skills and achieve competencies. We want to empower them by validating that they've done a really good job. How do we do that? Going through that skills checklist. We want our skills checklist to align directly with what is in the actual textbook. If we don't, if there's misalignment, we know students can get confused. Same thing in the clinical setting. We want to ensure there's alignment between these psychomotor skills that students are learning about, that they're imitating, right? Initially, at least, in the actual clinical setting. We want there to be alignment, and we want to reinforce those same steps in the clinical setting and in the didactic setting. If there's misalignment, we want to clarify with our clinical faculty, with our SIM faculty, with our didactic faculty, where the mismatch is, and we want to correct that as soon as possible. What else is it that we know about the psychomotor learning domain? Well, when students have so many reps under their belt, then they reach that naturalization stage where they no longer have to look at their notes because they've repeated those same steps over and over again. Now, here's the caveat. If students deviate from that consistency and following those steps, they will not reach naturalization stage. This is why it's so important when we talk about evidence-based practices that we reiterate with our students the importance of consistency in following evidence-based practices. That is going to help them achieve that highest level of psychomotor learning domain, which is naturalization. It will, in essence, be natural for them because they followed those same steps every time. It's just like driving a car. You all know I like using navigation examples just because they're so relevant. When we drive home from work, right? If we go to the same workplace every day, now our phones are so smart, it will tell us without even knowing that we have to go to work. If we're going to that same place so many times, it will say, okay, pop-up alert. It will take you 12 minutes to arrive at this destination. Or if you're going to the gym every morning or taking your child to school every morning, same thing. You know, when we talk about AI, that is a type of AI. There's so much memorization that is kept in the tracking system with our phones that naturally our phone is making an assumption. You know what? She goes to this place 5 out of the 7 days. I bet that's where she's going today. Or on Sunday, if you drive to church, Your phone may say, oh, it's going to take you 15 minutes to get to your church location because your phone knows that you go to the same place and it is trying to assist you, aid you in your planning for the day by telling you how long it will take. Okay, so AI exists everywhere, even when we don't ask for it, right? We get this information. All right, so let's take a look at some examples. Let's see what examples you came up with that match what we have here on our slide. All right, so clinical post-conferences, applying a lecture immediately using situation analysis. Oh, that's a really good one. When we think about those unfolding case studies in the classroom, this is a perfect example of how we can engage in cognitivism and to reinforce Bruner's work. If we're talking about cardiac system as an example, we can engage in learning circles with our students and ask them to develop a case study, and they can draw from their direct care experiences, right? That maybe they have a really good case study that's aligning with the cardiac system and our learning objectives for that day. So we want to engage our students in that social learning theory also by asking students to kind of group together to then put the specific details, concepts that we've talked about related to the cardiac system, integrating that into the case study. And then we're going to come back together, right? This is the guided or the facilitation process of learning. We want to give students feedback about them being able to integrate these concepts that we have explored during our actual lecture. Okay, so that's what we mean by situation analysis, and unfolding case studies are an excellent example of us being able to integrate that evidence-based practice into our classroom experiences for learning to happen. All right, it's time to debrief and reflect. So think about, what was your objective for our time together today? Did you accomplish that objective so far? Maybe you're waiting to see what the correct answer is for our thought-provoking question. That's okay too. But we want you to take some time to debrief and reflect on what was your takeaway from today. Did you learn more than you expected to learn about? Did we create more clarifying questions for you, more muddy points? That's okay too. We want you to write those down. A key step in this process on the journey to achieving that passing score on the C&E exam is being very clear about what it is that you know and what is it that you don't know, right? Because by the end of your 7-week study plan, we want you to have identified those 3 muddy points related to those 63 sub-competency statements if you're taking the C&E. For the C&E novice and C&E clinical, it could be, depending on where you are on your journey and the content that you're focusing on, you could have maybe 12 or so muddy points, and that's okay. You want to just have a very clear plan of how you're going to close the loop and clarify those muddy points that you have. Okay, so think about where you are on your journey. Remember, everybody's journey is different, but being honest about what your gaps are is a really important step as you debrief and reflect. All right, so let's take a look at this thought-provoking question. If you chose C, encouraging students to practice one specific clinical skill daily, building upon each skill progressively over the course of the term, give yourself a round of applause. And if you did not choose the correct answer, we do not want you to get discouraged. Okay, let's talk about why A is not correct, which says focusing on comprehensive assessments at the end of the term to gauge knowledge retention. Think about, what is your question? What is this question asking you, right? The 2-step process. Number 1, what is this question really asking me? So let's take a look. It specifically asks, which of the following strategies best supports long-term retention and application of clinical skills? Well, focusing on comprehensive concepts may be able to help us gauge the knowledge gaps that students have, but it's something about at the end of each term, right? We want to find out throughout the process. Okay, so maybe that one was one that was a toss-up for you. So we'll go back to that and just talk about the difference between A and C. And then B, incorporating spontaneous, unannounced practical exams to simulate high-stakes environment. Well, unannounced practical exams, so those would be quizzes, that does help us really validate whether learning has happened from a formative assessment. But simulating high stakes, that really doesn't have anything to do with being able to validate that learning has happened. So we want to think about, what is it that this question is really asking us related to option B. And it's really not aligned, right? Because remember, the question is all about how do we support? What's the best strategy to support long-term retention and our students' ability to apply these skills within the principles of incremental improvement. So that term incremental improvement really is more aligned with formative assessment and development over time, which that's exactly what C tells us, right? We're scaffolding their learning. We are building on that prior knowledge, those prior skills in a way ultimately that will help students apply clinical skills. There's also a term called decontextualization where we're breaking down the steps so students can, first of all, break them down so they understand the rationale for each of the steps in sterile technique. And then we want them to be able to put them together, right? Or contextualize them, situate them in a real patient care situation. All right, so that's the difference between A and C. A, comprehensive assessments at the end. Well, we actually want there to be incremental improvement, like it is described in the question. And then B really isn't related, right? It's talking about high stakes exams, and that's really not the focus of the question. So this is what I want you to do. If you all are thinking about, well, I don't completely understand that question, I was confused by what the question was asking, just go back and reread it. You know, the goal is that it is triggering some thoughts, maybe bubbling up some muddy points that you may have. And we want you to think about how are you going to close the loop? First, you're going to start with Billings and Halstead, Chapter 16. Look at each of those evaluation strategies. Be clear about advantages and disadvantages. And second of all, align it with the learning theory. That's going to help you have a deeper understanding of the rationale for each of these evaluation strategies. All right. And then, of course, as always, you can reach out to us if you have any further questions. info@drsellerseducate.com. Until next time, thank you for joining. Make sure you subscribe, and we'll see you in the next snapshot.